When should I visit a gastroenterologist? Hi, I'm Dr. Arun Yelamali, surgical gastroenterologist from Hubli. We get this question a lot of times. So, what are the symptoms which should lead a patient to visit a gastroenterologist? See, when we speak about gastroenterology, a lot of organs are involved, starting from the esophagus, stomach, intestines, the small and large, liver, pancreas, gallbladder, rectum, even the anus. And sometimes you also get diseases of the abdominal wall, such as hernias. So, each organ system comes with its own symptoms for which you would want to visit a gastroenterologist. Let's talk about a few of them today. Okay. So, one is the esophagus. So, esophagus is the food pipe. So, what it does, food when we eat, it goes from the mouth to the stomach. So, any symptoms there, which are commonly heartburn, that is pain behind the chest, difficulty in swallowing, sometimes hiccups, burning, chest pain, these may be symptoms of a esophageal disorder. Now, coming to the stomach is a bag in the abdomen which does the initial part of digestion. So, stomach produces a lot of acid, and commonly patients present to us with a lot of burning, acidity, gas formation. So, these are some of the symptoms of a gastric disorder. There are other symptoms like weight loss also, which might occur in certain gastric diseases, for which you can visit the gastroenterologist. Next, if you go to the intestine and the large intestine, usually there are problems like diarrhea, constipation, pain abdomen, which is one of the most common symptoms for which you would want to visit a gastroenterologist. Other organs such as liver, gallbladder and pancreas, they usually work together to help in digestion. So some of the common symptoms that would lead you to visit a gastroenterologist would be again pain abdomen, in mainly the central abdomen, back pain, symptoms like jaundice. Jaundice would present like yellowish coloration of the eyes, yellow urine, itching. Again, you might have weight loss. Now, other common symptoms which might be more alarming are bleeding. So, bleeding can occur both from above the upper intestine, in the stomach and the esophagus, which would lead to blood in the vomiting, and there might be bleeding in the motions also. So, these usually are due to some benign diseases, but in rare cases can be because of some cancers. So, bleeding as a symptom cannot be neglected. In case of any bleeding, please visit a gastroenterologist. Then there are other symptoms such as abdominal wall swellings, which are indicative of a hernia, which can also be treated by a gastroenterologist. Now, some other cases where you would want to visit a gastroenterologist, which are very important, is if you are a chronic alcoholic, smoker, tobacco chewer, because these are very high risk conditions for GI malignancies, that is cancers. So, in these, if you are one of these, you need to consult a gastroenterologist. Another common disease that is caused with alcohol is pancreatitis and liver cirrhosis. So, liver cirrhosis is a condition where the liver starts becoming stiff and goes into liver failure. So, this also is treated by a gastroenterologist. And pancreatitis is another condition which is commonly affected by alcoholism, which causes inflammation of the pancreas, which can lead to life-threatening acute pancreatitis, or in the long term chronic pancreatitis and digestive diseases. So, all these conditions can be managed by a gastroenterologist. If you are still not sure, you can just visit your local general practitioner. He will be the best person to guide you to which specialist you need to visit.